to everyone, and in this video we'll be discussing on the kidney anatomy of the kidney, and the video will be in two parts. And first will be the basic external structures relations of the kidney, and the second part will be seeing the internal structure, that is our microscopic, all the capsules or the sagittal section of the kidney, what are the renal fascias and all. Okay, so first of all, if we talk about the kidney, so kidney, as you know, is a paired organ in the abdomen region, and the shape of the kidney is bean shape and the color is reddish brown. Okay, so these are the basic features of the kidney, you know from the basics, and it is situated in the posterior side of the abdomen, that is called as posterior abdominal wall. Okay, and this is a major excretory organ of our body, as it eliminates the excess water and salts, and all the wastes or the protein metabolisms all are done by the kidney. So it actually maintains our electrolyte and the water balance in the tissues of the body. So these are the functions of the kidney which you know. Now we will be seeing the skeletotopy, or you can say the situation, that is where the kidneys are located, left and the right. We have a difference between left and the right kidney. So if we talk about the skeletotopy, as we say, so you can see in this diagram, you can see, so this is actually your right kidney, this is your right, and this is your left kidney. Clear? So from left and right you can see the positions of the kidney here, and as we talk about the skeletotopy, so it lies from T12 to L3 vertebra, so thoracic 12 till lumbar 3. So in this regions we see the kidney, but the right kidney actually originates from L1 and the left kidney from T12. So this is a major difference between the left and the right kidney. Okay, according to the position or situation or location, you can say, simple. So right, we can write like right is situated from L1 to L3. Okay, and left is situated from T12 to somewhat, you can say, the body of the middle body of the L3. Okay, L3. Okay, and from T12 actually we see, if we say the according to the vertebra, so it actually originates from the upper part of the upper body part of the T12 and ends on the middle of the body of the L3. This is the exact location, but if you say with respect to vertebra, it is from T12 to L3. Clear? So this is the main difference between the left and the right kidney. And if we talk about and the reason why this right kidney is lower is because of the presence of liver on the right side, and because of that the right kidney is, so first point is the right kidney is lower due to right kidney is lower than left kidney due to presence of liver on the right side. Okay, due to presence of liver on right side. Clear? So this is the main difference why the situation, the location is different. And if we talk about the median plane, just consider this is a median plane or middle part of your body. So the left kidney is little nearer to the median plane than the right. So left is little bit near to the median plane as compared to the right. So this will be your second point, that left kidney is near to your median plane. So this is actually your median plane. Okay, so left kidney is near to median plane. This is the second feature of the kidney. And now if we move on to the third feature, so both the kidneys move downward in the vertical direction for 2.5 centimeter during the respiration. So during respiration the kidneys move downward around, you can say, 2.5 centimeter downward. So this is one of the features. Okay, so these are the main points regarding. Now if we talk about the golotopy, you can say, or you can say the 9 abdominal region where it is located. So if we schematic representation, if I show you here, just you can see here, just consider these are the pyloric planes and these are the 9 abdominal regions. So kidney actually lies here. So this will be your right kidney like this. Okay, clear? And left will be somewhat median to the medial plane, as I told you. So this will be the location of your kidney according to the 9 abdominal regions. So you can see the regions you cover, like this is your epigastric, this one is your umbilical region, this epigastric, and these are your hypochondric left and right, both the kidney as we see, and these are your lumbar regions. So if we talk about the presence of kidney according to abdominal wall, so they are present inside So they occupy what spaces? They occupy epigastric. It is with respect to both the kidneys. Epigastric, we have a hypochondrial region, right and left both chondric, and we have lumbar and the umbilical region in the center. So from all the side, it is just occupying these 4 regions of the abdominal wall. Okay, so these are the golotopy. Okay, clear this much. And now if we move on to the external features of the kidney, we have like 4 external features each kidney is having. I will writing it here. Now just consider this is a kidney, and we have 4 features here. The kidney has 2 poles. Okay, 2 poles. Second kidney has 2 surfaces, and third we have 2 borders, and lastly we have the hilum. So these are the external features of the kidney. So this poles, surfaces and borders I will show on this diagram. You can see it here. Okay, it will be clear here. So you can see poles. The meaning of pole is we have upper and lower poles. Okay, upper and lower you can say, or superior or inferior. So we have superior and inferior poles, 2 poles. So meaning of superior and inferior pole is that this you can see in this kidney. Just see it. So this is actually your superior pole, and this below one is your inferior pole. Okay, so these are the external features of the kidney. Now we talk about the surface. We have anterior and the posterior surface, anterior and the posterior as usual. So anterior will be on from, as this is the diagram for the anterior side, so this is the anterior surface, and on the back side will be your posterior surface. So these are the 2 surface, and 2 borders we have medial and lateral border, medial and lateral. So now medial, you can see this will be on the median plane towards the medial, so this border will be your median border. Okay, median border, and this border will be your lateral border. Clear? So these are the external features, and hilum will be here. So this is your hilum, from where the vessels, veins and arteries will be originating. Okay, so this area is your hilum of the kidney. Clear? So these are the specific features of the external features of the kidney. Now if we talk about poles, so superior poles, as you can see, it is thick and round and lies near to the median plane, as I told you, and it is related to suprarenal gland. So on the superior pole we have the suprarenal gland like this. So this is a one feature of the superior pole. On an inferior pole, it lies it is somewhat pointed, and it lies above the iliac crest. Just consider here, it will be your iliac crest here like this. So it will be lying just 2.5 centimeter above the iliac crest. So this is the specific feature for this lower pole or inferior pole. Okay, and if we talk about the borders, so in borders, in the medial side, on the upper and the lower poles, the border is actually convex. Okay, but on the middle of this medial border, this part is concave. On the lateral side, it is fully convex. Okay, so this is actually convex, but on the medial side, upper and the lower, but the middle is concave, upper and lower are convex. So this is a specific feature regarding this. And hilum, we have vessels, we have renal vein, renal artery, and renal pelvis, you can say, or ureter originates from here, and somewhat subsidiary branches of your renal artery. Okay, so if we talk about the relations of respect to this, if you have to consider like it is a anterior side or posterior side, so just consider this is your kidney. Okay, clear? So first will come your renal vein. Okay, first will be coming your renal vein. Clear? Like this renal vein will be there, and from back side there will be, posterior to renal vein will be your renal artery, renal vein, renal artery, and on back side will be your renal pelvis. Okay, or ureter. So if you have to identify the kidney from the anterior side, so first of all you will see the renal vein, then will be renal artery, then will be your renal pelvis. So this is the relation from anterior to posterior side. So most anterior will be your renal vein. Okay, so this much is clear. So these was the external features, And now we will seeing the posterior relations of the kidney on this diagram. So let's start with the posterior relations of the kidney. These are the posterior relations. Okay, so this diagram for the posterior relations of the kidney. So on the posterior relations, on the posterior side, we have one difference according to ribs between left and the right kidney. Okay, and this is your left kidney. As you know, left kidney is above than right kidney. So this is the diagram of the left kidney. Okay, so difference I will tell you between left and the right. Now first, this is your diaphragm. Diaphragm will be covering the upper part. So this part, this dotted, you can see this dotted in the white portion. This is your diaphragm. Okay, and diaphragm we have two ligaments. This is your medial arcuate ligament, and this is your lateral arcuate ligament. So this is your lateral arcuate ligament. Lateral arcuate ligament of the diaphragm, it is present somewhat below. So this will be actually covering your posterior side. Okay, so diaphragm will be present firstly, then comes your medial arcuate and the lateral arcuate. Now we have three muscles. Okay, from this is the medial side, this is the lateral side. Okay, so three muscles. As you know, the posterior abdominal wall has three muscles, so those muscles will be present on the posterior side. So first muscle, you can see this will be present here. This division, you can see this is psoas major. Psoas major will be present firstly on the medial side, then will becomes your quadratus lumborum, and third will be your transverse abdominis. So these are the three regions. You can see this part, this is quadratus lumborum, this is psoas major. Okay, so these are the three regions. So this is your transverse abdominis. Okay, so these are the three muscles. Three muscles will be present here. Four muscles actually. Diaphragm is also a muscle, so we have four muscles: 1, 2, 3, and 4. And now what will be present here? Now we will be having nerves here. Okay, nerves will be present. Three nerves. You can see this yellow one. So this yellow ones are denoting nerves. So first nerve will be subcostal nerve. This present below the rib. So subcostal. Then comes your iliohypogastric, this second one, and this is your ilioinguinal. Inguinal region is below, so ilioinguinal here. So these three nerves, subcostal nerve, hypogastric, and ilioinguinal. So these are the three nerves by yellow. And now subcostal vessels will be present, that is the vein, artery and the vein. So these are the subcostal vessels. Okay, so clear this much. And ribs, you can see 11th and 12th rib. So this one is your 11th rib and this is your 12th rib. So this is a left kidney. So in left kidney we will see two ribs on the posterior side, 11th and the 12th. But in the case of right kidney, we will be only seeing the 12th rib. So this is the major difference between the right kidney. So in the right kidney we have only 12th rib on posterior side. Okay, 12th rib on the posterior side. So this is the major difference. So we have four nerves. Just for remembering, you can remember four nerves, four muscles: diaphragm, psoas major, quadratus lumborum, transverse abdominis. Three nerves: subcostal, iliohypogastric, ilioinguinal, and one or two ribs. One rib in the right kidney and two ribs in the left kidney, 11th and 12th rib. So this is the posterior relation you will see here. Okay, clear this much. Now comes on to move on to the anterior relations. So anterior relation, we have different diagram. So this is your anterior relation. Anterior relations. Okay, so anterior relation, it will be easy. Just have written everything. So on the anterior side you can see, first of all, anterior side for the right kidney. So this is the right side. Okay, this is the right side and this is the left side, left kidney. So anterior relation, first of all, we will be having the right suprarenal gland. This is your right and this is your left. So left. So right suprarenal gland. Okay, we will be having right lobe of liver, hepatic area as I have shown you, right lobe of liver. Clear. We will be having duodenal area, that will be the second part of duodenum, specifically part of duodenum. And fourth, we will be having the jejunal area, you can say jejunum will be present, jejunum, and we will be having the flexure. So on the right side we will be having the hepatic flexure or right colic flexure. Clear? Now we move on to the left side with respect to anterior relations. On the left side, first of all, we'll be having left suprarenal, similar, clear, gland. Second come will be your gastric area, that is the gastric part, stomach, simple, stomach. Then will be your spleen, okay, pancreas will be present, and like right colic flexure, there will be the splenic flexure or left colic flexure, okay, similar. And sixth will be jejunum, the same, jejunum will be also present. So these are the areas, you can see these are diagram, like gastric area, stomach, this is your splenic area on the left side, pancreas will be present, so pancreatic area will be covering this area. Blue one is jejunum, so here jejunum will be present, and this is your colic area, okay. So here also colic area by pink and blue. So this will be liver here, liver will be only present on the right side, duodenum will be present second part here, second part of the duodenum. Clear? So this was the anterior relation of the kidney. So I think it is clear. So we'll be discussing the later anatomy of the kidney in the next video. Thank you.